everybody, today's video I'm going to share with you a case study of somebody I've been working with for a few sessions now that has complained of bilateral hip flexors, groin, adductor, and knee discomfort. And I'm going to share you a little bit more about her case and one specific simple movement that we did that decreased a lot of that discomfort. My name is Dr. Dawn. I work at Performance Place Sports Care, just one part of the locally world famous chiropractors here in Costa Mesa, California. We're going to hop right into talking a little bit more about this case study. So this specific person, originally this pain had started while doing some strength training, specifically a good morning. The pain had originated from her low back. Okay, and as time went on, as she had gone through PT, she had her ups and downs with what had worked, what had not worked, and just life. Pain had gotten better, and then it got worse with some movements through physical therapy that just weren't right for her. So the pain now that she is presenting to me with is what she would say is more her QL area back here. Okay, that area bugs her a little bit. It feels tight, but most of her pain, tightness, soreness, achiness is in the front of the hips, inner thighs, and sometimes the knees. It has really affected her quality of life and ability to just do things that she loves. So as we've kind of trialed and errored through what has worked for her, the last session that we had together, I'm going to back up a little bit. We had actually, her knee pain has been pretty good and almost non-existent. Adductor pain comes and goes. Front of the hip pain also comes and goes, but the day that she presented to me most recently was she was dealing with just this like side body into her, what she would say her TFLs, the side of her hips was just really, really sore. I do believe that all of that stuff is very much related, and all of that can benefit from this one simple movement that I'm going to show you here. So the way that it was coached to her was actually in a chair, but just for, room and camera purposes today, I'm going to show it to you on the floor here. So pretend this is me sitting in a chair. This also can easily be done sitting on the floor as long as it's comfortable for you and your hips can tolerate it. So typically when we sit in a chair, we're all sticklers about our perfect posture these days. So I told her to just relax a bit and allow her back to round backwards here. Okay, she found where it started to get a little bit stretchy and asked her to breathe into that stretch. I want her to feel like her breath is stretching it more. The stretch, we were focusing on what was happening around her back here. So we found a little sloppiness. We took big deep breaths in through the nose and out through the nose to stretch that area. And what we know when we're doing this properly is you can actually see the area of the back move when you breathe into it. I'm not sure if you can see it right now, but I'm going to try my best. So I'm going to over exaggerate it. Okay, you'll see that a little bit more flexion happens in the back when you take those massive deep breaths in, forceful breaths into the muscles. We worked through 20 of those breaths. After 20 breaths, which only took a couple minutes, we stood back up and we retested all the things that were painful and uncomfortable for her, and she said it was almost non-existent. So simple. Such a simple movement to put yourself into a seated position, elbows forward, round your back a little bit, and breathe into it. A lot of times there's a lot of information out there about a rounded spine and things of that sort. With this particular person, we needed to round her spine. It gave her tons and tons of relief, and we paired some exercises to go with it. So I want you guys to carefully try this at home if this sounds like you. It's really, really easy to just let your body tell you if this is okay and safe for you. It will let you know. Do not push through anything that's uncomfortable or that's getting worse the more you do it. This is not a no pain, no gain type of approach here. It's all about how do we decrease discomfort and show you that you have some control here. So a little bit around, breathe into that to feel like you're stretching the muscles with your breath from the inside out. Retest your pain afterwards and use that if it works for you. If you want to know a little bit more about what you can do, there might be a webinar that pops up as well. There's tons of stuff on there about groin pain, hip pain. There's a back webinar as well if that's something that you're dealing with. click on that free resource. Sebastian and I hop into educational pieces, categorizations of hip pain and low back pain, diagnoses that go along with it, and exercises that you can try. Our YouTube channel has tons of that stuff already as well, so click on our channel, like and subscribe, type in whatever you're dealing with. I promise you it's gonna pop up. But if you want to know specifically what you should be doing for your body, please reach out to us virtually or in person. We can help guide you in the right direction. Talk to you soon.